So I did not realize how many of you live with chronic pain, and I didn't know how many people would actually comment on my post that I posted recently about chronic pain. And so I wanted to do a follow-up. It seems like a lot of people, maybe it's because of our age, right? But actually I thought that I would follow up on this because this seems to be something that a lot of people struggle with. So chronic pain, how do you thrive? Not survive, but how do you thrive with chronic pain? And I can tell you as a nurse and as someone who has family members who struggle a lot, I don't mean a little, but a lot with addiction, that's just never been an option for me. Taking painkillers has never been an option. So I wanted to just sort of talk to people about what I do and hear about what you guys do. So I not only have scoliosis, which in and of itself has never really been a problem, but then I had an injury. And so that was when I started to feel this chronic pain, and it was super frustrating. I'm not a little bit active, I'm like a lot active. Any of you who've been following me for a while probably know I practiced martial arts for many, many years. I have 2 black belts. I've been a gym rat since I was 16. So it was really hard, and it happened, the worst of it happened right before quarantine. So that was even worse because I'm like, oh no, like now my coping mechanism for stress is like sort of affected. So I wanted to really share with you some of what I have figured out and what works for me, and what someone asked what I'm doing for scoliosis. I will get to all of that. I'm going to get to your questions in a little bit. So I want to share with you a book that someone shared with me. And I'm getting weird light on my face, so I'm going to like move a little bit here. So I have a friend who shared something with me, and it's called the Mind Body Prescription. It's a book that I read that someone shared with me, and it's really interesting. And when I first read it, I got really irritated. So don't be surprised if you get really irritated when you first read it, because you're gonna go, wait a second, are you saying that this is all in my mind? So the truth is, no, it's not all in your mind, because if you've had an injury or you have trauma to an area, sure, that can affect you, right? But it's going to affect you. You don't want to ignore that by any means. But there is a huge connection between what's going on in your mind and what happens in your body. So at Amen Clinics, we talk about 4 circles. We treat everyone with mental health issues through the lens of 4 circles: biological, psychological, social, and spiritual. All of those are super important in helping people become the healthiest people they can become. Well, the same is true with chronic pain. You want to be thinking about what are all the causes that it could be. And believe it or not, psychological is a huge issue. But we in this society have this idea that if there's something psychological going on with you, then, oh, it must be fake, or, oh, that's a really bad thing. We have this like weird connotation. No, it's actually real. So after I got over myself and I read further, this guy, John Sarno, is an MD, and it's super, super interesting book. And I started to realize, because the person who actually recommended it to me is a very high level, extremely functional, like super fit person. Let's just say he's got a really high level job. And so I thought, if he thought enough of this book, I'm going to read this book. And so when I read it, I thought, okay, this makes perfect sense. So there are some things in our brains, like psychologically, mental health wise, that are just too much to handle for some people, right? Especially if you're a really good person, you have thoughts that you just think you shouldn't be having about people or situations or whatever. And it's almost like the better person, the more of a good person you are, the more that your body doesn't want it, like your mind doesn't want to think of those negative things. And so it becomes almost too much to deal with. And so it's got to express itself in some way. Oftentimes, in the weakest part of whatever's going on in your body, you're going to feel pain because it's got to come out somewhere. And there's also a physiological aspect to that. And that is that when you are under a tremendous amount of stress, everything tightens up. Everything like just clamps down. And so now you've got a lack of oxygen and a lack of blood flow, right? So that increases pain dramatically. So whatever you might have had from an injury that maybe you used to not have as much pain from, now you got excessive pain. And I certainly experienced this myself. So what I want to share with you is I was noticing that like, yeah, I used to be able to get through this. I used to be able to do like stretch and do certain things and just get through it. Now all of a sudden it's affecting me. I'm not getting through it as easily. And so one of the suggestions in this book was make sure you're journaling, and don't journal in the way that we've all been taught to journal. One of the things we teach people is focus on what you're grateful for. And I still want you to do that. However, just humor me for a minute. In this case, I want you to actually journal and just rage. I want you to like actually journal and really focus and get all of the like anything, and you got to spend some time on this because you might be angry about things you didn't even know you were angry about because you've been hiding it and suppressing it for so long. Think about all the things that you are angry about and just get it down on paper. You don't have to share it with whoever it is you're angry with or whatever it is you're angry with. It doesn't really matter. You can burn it afterwards, but get it down and just really dig into it and just rage at whoever it is on paper. And it's shocking. And it's like, I remember doing this and looking around and going, oh my gosh, I hope nobody can read this. I hope no one sees me. Like, because if you're a good person, you just don't want to do it. But the truth is, all of a sudden I realized I felt like such a relief afterwards. And of course, then I tore the paper up and it didn't matter and whatever. But it was just getting it out was amazing. And then I started meditating afterwards. So you get all the rage out, meditate, and then focus on what you're grateful for. And you can do the turnaround on all of the things that you're angry about, right? And so now you turn it around afterwards. But you got to get that out, because if you don't, your mind is going to find a way to express all of that stuff somehow, and it comes out physically. So that's one thing. So of course, trauma, physical trauma is going to cause pain, but so does emotional trauma. Emotional trauma causes pain. In fact, I don't know how many of you have heard of ACE scores. So ACE scores are adverse childhood experiences. So there's a test. You can go online and look up ACE scores. You can take a quiz on adverse childhood experiences. Anyone who has scored above a 4 on a scale of 1 to 10 is at much higher risk of dying of all causes 20 years earlier than people who haven't. And that's super interesting. My score is an 8. My nieces that live with me are a 9 out of 10. So when you just look at it through that lens, people who have gone through childhood trauma tend to experience more illness, which I had 10 medical surgeries, first surgery at 9 years old, had cancer, so you just start to see it. I was sick all the time, frequent flyer in the hospital. And then chronic pain is a big thing that people with childhood trauma will experience later in life. So if you look at it through that lens, and then you begin to realize, oh, by working on my earlier trauma, which is similar to what I'm talking about, working on trauma is basically getting it out, right? So if you're journaling and getting that rage out, and you learn how to like deal with all of that stuff that's been suppressed for so long, it's shocking like how much it can really help. Now, that is the psychological circle. Of course, you have to deal with the physical circle, which is what damage did you do? Like I had an injury in karate. And so you have to don't damage it any further, obviously. So what do? I decrease my stress. I make sure I'm decreasing my stress by doing those things. Increase oxygen. So make sure you're doing deep breathing. If I have an opportunity, I go into the hyperbaric oxygen chamber. I journal, like I just told you. I journal in the way I just told you. Exercise. So this is the catch. So this is what a lot of you commented on. So many people commented, well, I haven't been able to exercise. And because I posted something about exercising while I was in chronic pain. And here's the thing. I always focus on what I can do, not on what I can't do. Because if I don't exercise, I find myself getting depressed and feeling more pain. Depression is a huge cause of chronic pain. It will increase your pain dramatically. Depression will increase your pain. Not exercising will increase your depression. So you see where I'm going with this. So if you can focus on what you can do. So if my low back hurts, I'm going to focus on, even if that day my low back is hurting, I'm not going to do something to hurt myself more, but I'm going to focus on what I can do. If I can do upper body, I'm going to do upper body. And I've noticed like, oh, I can't load my spine. I'm not going to stand up and do squats with a loaded spine, but I can sit down on a leg press, or I can do leg machines when I'm sitting. So I figure out what I can do to keep the muscles in my body strong around that area so I don't get hurt more. And also so it helps me cognitively, it helps me psychologically. So I always focus on what I can do. And Natalie, who works for us, she's a quadriplegic, and that girl knows what pain is. Okay. Quadriplegics, anyone watching me who knows someone who is paralyzed knows they have a lot of pain. And that girl is my inspiration. She exercises every day. And I'm like, if I know a quadriplegic who exercises every day through pain, I have no excuse. I can figure out something to do. Even if I have to take it easier, I can figure out something to do. So I don't know any of you who know someone like that inspires you, but I also have another friend who has cerebral palsy. If you know anyone with cerebral palsy, they have wicked muscle spasms, and he exercises every day. And so I used to work with kids with cerebral palsy. So if those people could exercise every day, I can figure out how to exercise, even if it's a little bit different. I just alter what I'm doing. That's going to increase blood flow. It's going to increase oxygen, because when you are stressed and when you don't move, the stress clamps down on those muscles. You decrease oxygen, you decrease blood flow. That increases pain dramatically. So then obviously the spiritual and physiological, psychological, spiritual, and social. So make sure that you, people who are purposeful actually not only live longer, they're happier, and they tend to, it actually helps with chronic pain when you have a support system and you are purposeful. So we always want to focus on those circles as well. But I wanted to share that with you. Those are some things. Oh, can't forget this. Make sure you are sleeping. If you're not sleeping, minimum 7 hours. I need more like 8. If you're not sleeping, you are definitely going to increase your pain. I don't know about any of you, but I'm grumpier. I have more pain. Nothing goes well in my day, and nobody around me is as happy when I don't sleep. I'm going to move this a little bit because I'm getting sun. And then there are supplements. There are supplements that help with pain. So anything that's anti-inflammatory. So make sure you are decreasing inflammation in your body if you want to decrease pain. Anything that increases inflammation in your joints is going to increase pain. Sugar, alcohol, simple carbs, anything that's increasing inflammation. Gluten, for most people, will cause, if you go on an elimination diet, it's usually going to help most people. And then there are supplements. Things like SAMe can be really helpful. Anti-inflammatory supplements like curcumin can be super helpful. Quercetin, things like that decrease inflammation. So all of those things. Now, I don't know. Some of you get away with doing 1 or 2 things. I don't. I'm one of those people who's kind of a seeker, and I do everything. So when people say, what's the one thing I can do? I'm like, do it all. That's the one thing you can do. Do everything you can if you want to live a great life, right? So someone said, so how do you increase sleep? You increase sleep. I'm a sleep princess. I have trouble with sleep because I have to take high dose thyroid. So I'm not kidding about sleep. So I do, again, everything. Dark room, cool room. I don't do anything stimulating for about 4 hours before sleep. Warm baths, lavender tea. I make sure I wear an eye mask, earplugs, and I take things like magnesium, GABA, and I take a time release melatonin. We actually make something called restful sleep that helps me a lot because it's time release, just a small amount. And so someone said goat yogurt as a snack. Yeah, that's actually fine. Goat yogurt, believe it or not, most people who are allergic to cow's milk, a study showed that 89% of people allergic to cow's milk were not allergic to goat's milk. Now, some people still are, eliminate it if you are, but many people can tolerate cow's milk. Someone said Armour thyroid. So any thyroid can disrupt sleep if you're not taking the right dose. So you need to see a thyroid specialist. So if you're not taking the right dose at the right time, I have to take high dose thyroid because I had thyroid cancer that returned multiple times. And so the high dose thyroid keeps me sort of wired and tired and jittery. And so that's why any thyroid, if it's not correctly given, can disrupt your sleep. Someone asked about how to manage scoliosis. It depends on your scoliosis and how bad it is. Mine is sort of moderate. It's like mild to moderate. And so stretching a lot. I do Pilates and I stretch a lot, keeping my core strong and stretched. That's how I manage the pain with mine. I also love my Theragun. Theragun really helps for me. Let's see, any more questions that I missed? Love these questions. You guys are great. The name of the book, someone said, it's The Mind-Body Prescription by John Sarno. I actually found it to be really helpful. After you get over being irritated, you will find it helpful. So yeah, it's actually really good. When we say it's all in your mind, it's not all in your mind, but we say it's when it's in your mind, yeah, it's in your head. And that's not a bad thing. It's just a thing. Your head is part of your body and it actually matters what's in your head. So don't take it as an insult, right? Same thing with people, you know, when they have fibromyalgia and they're like, well, my doctor said it was all in my head. It's not an insult. When something is psychologically needs to be addressed, address it and deal with it, and deal with your trauma and deal with whatever's going on so you can live a better life. That would be my suggestion for that. So I don't think that that's a bad thing. I think that smart people get help. Weak people choose to ignore things and minimize it and say that it's for weak people to get help. That's ridiculous. So that is what I have to say about that. And let's see. So someone said they get 4 hours of sleep, live singly. Yeah, it's hard. I would start, we actually have a sleep specialist at our clinics. And I'm not saying you have to go to our clinics. There are lots of sleep specialists that can help you with that. Our sleep specialist, I love him, Dr. Criado. He's amazing. He knows so much about sleep. We have, I should do a live chat with him, huh? Another one. I've done live chats with him in the past. I should do another one with him on sleep, because sleep is a big reason people feel pain. If they can't sleep, they feel pain. Their pain is increased dramatically. So these are all things that will actually help you a lot. So any more questions, please don't hesitate. Send them to me. I'm going to lose all of these when I get off of this live chat. These questions are going to disappear and I hate that. So make sure you write to me and give me your questions. Oh, left your hubby's live chat to watch mine. We both post these afterwards, so thank you for that. But we will both post these as videos afterwards. So yeah, so you can watch both of them. And great. Thanks, you guys. And that's what I do. So when you have chronic pain, don't move less, move more. Figure out what you can do and make sure you are moving. If you don't use it, you will lose it and you will feel more pain. Have a great day.